correct. The federal government has decided to reopen the healthcare.gov website where you can purchase health insurance with federal assistance beginning on February 15th and running for 90 days all the way to May 15th, which has never happened before.
How is this going to work?
Well, basically, starting on the 15th of February, you'll be able to go online to healthcare.gov and shop for health insurance with federal assistance. If your income's below 400% of the federal poverty line, there'll be federal dollars there you can draw down to help pay your premiums.
Tell us, why is the federal government doing this at this time?
Well, during COVID, we know a lot of people lost their jobs. In Louisiana, as many as 300,000 people went unemployed at one point in time. And a lot of times jobs come with health insurance. There are about 400,000 people in our state who don't have health insurance today. And so this is a unique opportunity for them to get covered. They'll also find, when you go on healthcare.gov, at certain income levels, health insurance with premiums of $0 per month because the federal aid is so generous.
Now tell us, who is eligible to participate?
Anyone who doesn't get an offer of health insurance from their current employer would be eligible to go and shop on healthcare.gov as long as they're not Medicare eligible. So people under 65 who are not currently covered by an employer would be eligible to give it a shot.
What about people on Medicaid?
Well, you can actually access Medicaid through the healthcare.gov website. If you're already on Medicaid, that's going to be your best bet. If you don't know if you're Medicaid eligible, you can apply through healthcare.gov and it will let you know if you should enroll in Medicaid.
How complicated a process is this?
Well, they're going to want some basic information, your name, and you will have to estimate what you think your income is going to be for the year 2021. That'll determine how much your premiums are. I would encourage you to be conservative in those estimates and maybe aim a little higher than you think you might make it, because if you get it wrong badly, they'll want some of the money back.
Now, how does this work in terms of what type of insurance options are available?
Well, in a market like Baton Rouge or New Orleans, you'll find Blue Cross and Blue Shield policies on healthcare.gov. You'll find Vantage healthcare policies also on healthcare.gov. And there are around 30 different policies available at various levels of value. They divide them up by medal levels, like Olympic medals. There are bronze plans, silver plans, and gold plans.
And what are those type of options as far as those individual plans? What do they cover and what don't they cover?
The coverage is very comprehensive. It's federally regulated. It has to fit a federal definition called a qualified health plan, and it has 10 different categories of coverage. These are very rich health plans. The deductibles and the copays and the coinsurance are determined in many ways by your income.
Do some of these plans contain wellness benefits?
Yes, actually, by federal law, any plan offered on healthcare.gov has to comply with a rule that tells us around 40 different types of screenings, of therapies, of different prescription drugs have to be covered at $0 copay at the appropriate age and time of people's lives. So you're going to want to explore those benefits as well.
What does the research show about the benefits of wellness?
It's critical that people maintain a good relationship with a primary care physician. And these plans actually offer at least one visit a year with a PCP and with a nutritionist, things that we really could use here in Louisiana that'll help you to manage your life and to find out if you've got any chronic conditions that you need to work on. Our people who see PCPs on a regular basis have an ongoing relationship with a primary care doctor. We have hard data that they are in the hospital less and they live longer.
What do people have to bring when they get onto the website of healthcare.gov? What type of information should they have?
Well, think of it as the first part of filling out a tax return: name, address, phone numbers, social security number. Those are the kind of things that it'll ask you in addition to the estimate of your income and the size of your household. It'll want to know how many people you want to cover, because this kind of coverage can be affordable to cover mom, dad, kids, everybody.
What about pre-existing conditions?
Well, that's a great question. When you apply for coverage on healthcare.gov, it will ask you no health questions. Your health status is nothing to do with whether you're eligible for coverage or how much that coverage is going to cost. All pre-existing conditions are covered under healthcare.gov. The only behavioral health question it'll ask you is, are you a tobacco user? And that can affect your rates.
What about prescription drugs?
All the plans cover prescription drugs. There are different drug coverages and formularies. The carriers who are offering those plans will make those drug lists available on their website. So for example, if you're shopping for a Blue Cross plan, you can go to bcbsla.com and look up the plan you're shopping for and get all of the information about what doctors are in it, what hospitals are in it, and what drugs are covered.
What about COVID, and what type of coverage is available for someone that may have COVID or develop COVID?
Well, the beauty of the plans that are being offered during this 90-day open enrollment window is that they have very comprehensive hospitalization coverage. So if COVID hit you, and honestly, we don't know how it's going to affect you ahead of time. So if you ended up having to go into the hospital, almost every acute care hospital in the state are part of these networks. Most of the plans cover them, and the hospitalization coverage is very robust.
Now, do some of the plans include, are they individual plans, or do they also cover family members and children?
Well, all of the plans are individual plans, but you can purchase for spouses, for children, and get federal assistance for the whole family because the assistance level is based on household income.
It's going to run for 90 days. What are the dangers of people possibly just procrastinating and not doing it?
Well, we've got a real problem in Louisiana right now. A lot of people lost their health insurance because they were furloughed or because they lost their job. And up to 400,000 people in the state right now are walking around with no health insurance coverage. We can fix that in 90 days and draw down federal money to help us fix it. Don't delay. If you ended up in the hospital because of COVID, those bills could be very expensive.
What is your advice for people?
My advice is to take a look at your current situation. If you don't have quality health insurance through an employer, healthcare.gov would be your next stop. It'll let you know if you're Medicaid eligible for federal assistance, or eligible to buy a plan with no pre-existing condition worries and guaranteed premiums for the rest of 2021.
How can people get more information?
We are going to be writing extensively about this open enrollment period on our blog. That's straighttalkla.com. Straighttalkla.com is a place where you can go and you can read all about the parameters of this open enrollment period and understand what kind of insurance is going to be covered and what your opportunities will be to get covered. Also, healthcare.gov's website has a shopping tool where you can go in and price insurance without having to make a purchase. And then bcbsla.com, our website, has a lot of information about what doctors are in the networks, what hospitals are covered by the plans, and the drug list as well.